Thanks, Peter, and thanks very much for having me. Firstly, I'd like to acknowledge the work of Paul Russell over many years in fighting euthanasia and assisted suicide. I'm sure that Paul is known to many of you. Hope is the legacy that he created through his dedication, his hard work and his vision. He understands deeply the threat that the legalisation of assisted suicide poses to our country and to the most vulnerable members of our society. So I'd like to pay special tribute to him for the incredible work that he's done. He's left very big shoes to fill, and I'm very grateful and honoured for the opportunity to take up the fight where Paul has so capably finished it. Now, there's been so much written about the topic of euthanasia and assisted suicide, and it's difficult to condense it into a talk just for 25 minutes. It is a topic that divides us sharply, and according to polls, is consistently supported by many in our community, but I'll dissect that polling a little bit later on. And of course, the issue has come to prominence here in WA, with the Parliamentary Committee handing down its report last week recommending that it be legalised here in the state. So before I begin on the substantive topic of assisted suicide, I'd like to first talk a little bit about the broader issue surrounding the way that we on the Conservative side of cultural and social issues sometimes engage in politics, and in particular in public debates. And by Conservative, I don't mean in a party political sense. Rather, I'm trying to capture those of us who take a conservative position on cultural and social issues. Now, in the past decade, in particular, it can feel as though public debate and politics in general are dominated by those advocating for radical change in our society. What were universally held beliefs some 20 years ago are now relegated to the extreme category and seen to be outside of mainstream thinking. Now, some excellent work has been done by a couple of conservative commentators in the US, Maggie Gallagher and Frank Cannon, who make the argument that Conservatives have to date focused on the culture war and neglected politics to our detriment. They argue that whilst it's true that politics responds to the culture, it's also true that politics influences the culture. Now, we can sometimes feel that politics is not pure, or it's an arena that we shouldn't get involved in until we change the culture. However, it is through our engagement in politics, engaging in debate, and investing money, resources into political campaigns and candidates that will support our causes that we can change the culture and shift votes. Now, in this regard, they identify three important factors. Firstly, issues preferences must be deeply felt. So a passionate minority can move mountains in elections. And we only need to look at, here in Australia, the example of Get Up, who can wield enormous political influence in the country. Now, we don't need to agree with the values of Get Up, but we can learn from their approach, which results in a small vocal minority exercising incredible influence over politics and policy. So that's the first one, issues need to be deeply felt. Secondly, parties and candidates need to take up visibly different positions on the issue. So they argue cultural and political consequences are most dramatic when two parties take clearly articulated and opposing stands. And so conversely, they argue that cultural consequences follow when one of the parties chooses to ignore the issue when the other party takes a strong stand. And thirdly, as I think we're learning in this country, the issue must be long on the political agenda. To sustain the cultural impact of political involvement, those wanting to effect change must keep their commitments on the political agenda over the long haul. Now, their remarks are very specifically tailored to the American situation. However, I think their broader critique translates to the situation here in Australia. One thing they do point to is they've done an analysis on how much money has been spent in the political arena by conservative groups and by those who are more radical. And they did an analysis between 2007 and 2014, and they looked at all the conservative groups, and they spent $75 million in direct political spending. Then by comparison, they look at just two in the US, the Human Rights Campaign and Emily's List in 2016, and they pretty much spent that same amount of money in the 1 year. So in other words, only two organisations on the left will spend almost as much as the socially conservative organisations combined in that 2007 to 2014 period. So we are being out-organised and outspent. And when we're silent on issues, we lose the debate. And so just to quote them, when only one side is willing to speak enthusiastically about a prominent issue, people begin to believe there is only one side. The polls shift quickly as the hearts and minds of the mushy middle move towards the only visible position. If only one team is on the field, it wins by default. So we must engage, we must fundraise, and we must get into the arena and join the fight. And so it is with euthanasia and assisted suicide. Now, the pro-euthanasia advocates would have us believe that change is inevitable and that it's only a matter of time. But it is important that we continue to engage in the debate. And it is the willingness of people to date that have been willing to speak up that's meant that we've had so many wins in euthanasia, really. And I'll talk about that a little bit later on. So here in WA is where the next battle will be played out. So if we are going to engage in the fight, it's important that we're really equipped with evidence and arguments to make our case convincingly. So I'm sure most people are aware of the different definitions of what euthanasia is as opposed to assisted suicide, and the two terms are used sort of interchangeably, but euthanasia is where a doctor actually administers the lethal prescription. Assisted suicide is where the doctor provides the person with the prescription and then they take it themselves. So euthanasia has been legalised in the Netherlands, in Belgium and Luxembourg, and then assisted suicide is in the United States in Oregon, Washington State, Vermont, California, Colorado, Washington DC. In Switzerland, they have a different sort of system where it's through different loopholes. It's not illegal to assist someone in their suicide as long as you don't make any money out of it and you don't have any selfish motives. So that was the jurisdiction where the Australian scientist Dr. David Goodall went, very publicised assisted suicide case because he was tired of life. And we know in Australia that assisted suicide was legalised by the Northern Territory Government in 1996, and that scheme was in place for 9 months. That legislation was later overturned by the Commonwealth in 1997, and recently we've seen in the Senate, there was a private member's bill by Senator Leyonhjelm seeking to overturn that restriction on euthanasia in the territories, and that was narrowly defeated. And of course we've got the Victorian Parliament, which passed the Voluntary Assisted Dying Bill in 2017, and that is due to commence mid-next year. So it's important, if we're going to enter the fight, that we know how to respond to the arguments, because they are very aggressive in terms of presenting their case. So I've just put together 4 arguments against the legalisation of assisted suicide. Now, you cannot give some people personal autonomy without putting at risk other people's lives who are vulnerable due to old age, isolation, disability, mental health issues. Now, the number one argument that's being used by those who wish to change the law is personal autonomy. I should be allowed to choose the time and the manner of my death. And interestingly, the WA report is entitled "My Life, My Choice." So in our increasingly individualistic society, the focus is on the individual and their rights. However, the truth is you cannot legislate to expand the range of choices for some individuals without putting at risk the autonomy of others in our community who are vulnerable due to socioeconomic status, disability, gender, isolation, loneliness, those experiencing elder abuse. A regime in which assisted suicide is made legal and which the decision to ask for assisted suicide is therefore positively affirmed as a wise choice in itself, creates a framework in which a person with low self-esteem or who's more susceptible to the influence of others may well express a request for assisted suicide that the person would never have otherwise considered. We have data from Oregon, and this is from the government's own statistics. This is not being made up by anti-euthanasia advocates. They publish their statistics every year. Nearly 1 out of 2 people in 2016 who took their own life through the regime cited being a burden on family, friends, caregivers as a reason for doing so. In 2017, this has increased to 55%. So those who don't have the support of family and friends, those who don't have access to palliative care services, those who are lonely or isolated will be put at risk by the introduction of such laws. Secondly, there's no safe way to legislate for euthanasia. And we have so much overseas experience to back this up. The most recent report of Belgium's euthanasia regime details that 3 children were euthanased, 77 people suffering from mental health issues, and 173 people with no physical suffering who were instead experiencing afflictions such as addiction, loneliness, and despair. In the Netherlands, there have been no prosecutions for violations of safeguards in the past 15 years, even though its Euthanasia Commission details frequent breaches of the law. In the United States, we've seen cases where insurance companies deny coverage for chemotherapy and instead offer assisted suicide medication. So that demonstrates that providing choice for some does in effect limit choice for others. Thirdly, doctors are against euthanasia and assisted suicide. Now, the Australian Medical Association's position on euthanasia and physician suicide is as follows. The AMA believes that doctors should not be involved in interventions that have as their primary intention the ending of a person's life. This does not include the discontinuation of treatments that are of no medical benefit to a dying patient. In addition, 105 Australian palliative care specialists last year signed an open letter pleading with the Victorian Government to not legalise it, asking instead for adequate resources to help them care for those at the end of life. They rejected the active and deliberate undermining of their work in an effort to push these laws through. The vast majority of palliative care specialists and cancer specialists oppose the practice. And the last one I would like to look at in this grouping of reasons why we should oppose suicide is that assisted suicide offers the myth of a compassionate and peaceful death. So the choice being given is you could die this horrible, horrible, painful death, or we could give you this pill and you can have a really peaceful death. But data from longitudinal studies in Oregon found that 3% of assisted suicides had complications, including distressing symptoms. In the Netherlands, an analysis has shown that 7% of people experienced unexpected side effects, including regaining consciousness, vomiting, gasping for breath, and seizures. So next, I'd just like to look briefly at the WA report, which was handed down last week. So it was 608 pages. Despite its length, this report fails to address or casually glosses over key concerns about the consequences of the legalisation of assisted suicide. And in an attempt to discredit any serious critique of the gaping holes within the report, the committee predicts that any criticism of the report will come from those opposed to euthanasia and assisted suicide and dismisses it as lacking rigorous evidence to back it up. Notwithstanding their unwillingness to address concerns about the evident holes in the report, I think it's important that we flesh those out. So I've identified some of the key aspects of the report that I think we should be aware of in the campaign ahead. The full text of these will be put up on the HOPE website for those who may or may not be interested in reading through those. The first one, as Peter mentioned earlier, is death doesn't need to be imminent. So the committee declares that requiring death to be expected to occur within a predicted timeframe means that some individuals are unfairly excluded. So it recommends that assisted suicide be available to those who are expected to live for many years after they request to die. Patient doesn't need to be suffering from terminal illness to access euthanasia. So the test is grievous and irremediable suffering related to an advanced and progressive terminal, chronic or neurodegenerative condition that cannot be alleviated in a manner acceptable to that person, where death is a reasonably foreseeable outcome of that condition. And it's important to note that the test of whether the suffering can be alleviated is a subjective one, i.e. completely the decision of the patient. Physical symptoms are unnecessary, with existential suffering deemed sufficient for euthanasia. The committee's found that W has the lowest number of publicly funded palliative care beds per capita in the country. It goes on to say that access to palliative care is further limited in rural areas and almost non-existent in remote regions. Even so, the committee does not require the palliative care situation to be rectified, and therefore giving the residents of WA a real choice in end-of-life options before they think that euthanasia should be implemented. Additionally, the committee also included in the report that Palliative Care Western Australia had told the committee that the low number of publicly available palliative care beds meant that wealthier and better educated people have better access to palliative care, with services clustered in areas of high socioeconomic advantage. This is especially alarming given that the committee also found that access to specialist palliative care in the early stages of diagnosis might improve remaining quality of care, mood resilience, symptom management, and allow for death in the patient's preferred location. Just some other ones quickly. WA has the lowest uptake of advanced care planning in the country, and they found that doctors are not very they're unprepared to talk about death and dying with their patients, so they said that's a problem. So I don't know how that's going to change if they suddenly introduce assisted suicide, whether the doctors will suddenly become more forthright in talking about death. There's also doctors lack appropriate education in terminal sedation, and the committee failed to address concerns about the expansion of euthanasia regimes overseas. There's a few others, but I'm going to run out of time, so I'll direct you to the HOPE website in the next few days, and we'll put up the full text of this. As Peter said, there was one member, Nick Gorin, who studiously created his own dissenting report. So I would urge you to read this report, and we might be able to ask Nick about this later on, but it's very thoroughly researched and very evidence-based. And so I'd like to now look at the political fight here in Australia. And we should be really encouraged that to date, the story has been a positive one in relation to the wins we've had with euthanasia. So there have been numerous attempts to try and bring in legislation. So between 1993 and 2016, there were 51 attempts. So far, there have only been 2 that have succeeded in the Northern Territory, which has subsequently been overturned, and then last year in Victoria. And in speaking with a medical professional about the vote in Victoria last year, I was struck by his observation that this was a result that was triggered by politics rather than the actual substantive issue. The vote was won by just 4 votes in the upper house in Victoria. So in other words, he was getting at the fact that there are other factors at play that resulted in the politicians voting for the bill rather than just the issue of whether they were opposed to or supportive of euthanasia. And it is rare that there's only one input into decision-making processes. So it's important that in any future battles, we run multifaceted campaigns that acknowledge that political strategy, grassroots activism, and issues advocacy are the 3 cornerstones on which successful campaigns will be fought. When the Northern Territory did legislate in 1996, it was the first jurisdiction in the world to do so. Now, opponents of euthanasia were undeterred, though, and realised that it wasn't the end of the story, and through a very well-fought campaign, realised that they could overturn that legislation through the Commonwealth's powers under Section 122 of the Constitution. That law has remained on the books for 20 years now. HOPE was involved with the recent federal Senate vote on the private member's bill to overturn the Andrews Bill. When we first heard about the supposed deal that had happened between the former Prime Minister and Senator Leyonhjelm, I think everyone thought, oh, it's a done deal. You know, looking at the numbers in the Senate, it looked like it would just very easily pass. And the activists who were pushing for that bill were privately and publicly stating that they had the numbers. But the approach that we took, and not just HOPE, there were many, many organisations, ACL, many people around the country working on this, was to not take any vote for granted, recognising that different senators would have different motivations for how they would vote, doing our research, finding out what those motivations might be. And as was the case in the Victorian and the New South Wales campaigns, we realised it was so important to get the doctors to sit down with the politicians themselves and talk through the practical implications from people working in the field with the experience of what this actually would look like. This ensured that the parliamentarians were given evidence-based information and so that they could be guided by that rather than just by hollow or populist slogans. And that really did change hearts and minds with politicians. We also recognise that it's important for politicians to hear from their constituents. Through Hope, we organised a petition. We also organised targeted campaigns of emails from constituents to their senators expressing their views. And so during the short campaign, we had 5,468 individual users take action and email their senators on the issue. The grassroots activism is powerful when it's combined with direct political lobbying and cross-party cooperation. So we hosted a joint parliamentary session which was co-sponsored by Senator Abetz and Senator Don Farrell from the Labor Party. Now, I noted in a newspaper article just a few days ago, Senator Leyonhjelm has sort of written about why they lost and what happened. And he finishes it by saying, what we need is for some senators who voted against my bill to lose their seats and senators who voted for it, including me, to retain their seats. So in other words, they are focused on the politics of this. They're going to target those politicians and they'll be doing the work to make sure that those who voted against it will get not re-elected and those who voted for it to be supported. We have to have the same targeted approach when it comes to politics. It's in the parliamentary chamber where the laws are made. If we're not there, we're not in the game. And we also need to tell our stories about our loved ones. So we're now used to hearing so many distressing, really upsetting stories of people who've walked with their loved ones who've experienced unbearable pain, and people who are trying to change the law use those stories to try and change hearts and minds. But there are thousands of stories out there of people who've had excellent palliative care, who've had more time with their loved ones, who've resolved issues, who say they would never give away that time again because it was so precious. And we need to be telling those stories. And finally, I'd just like to make some remarks about polling in relation to euthanasia. So, as we hear all the time, pro-euthanasia advocates constantly refer to the high level of support in the community for assisted suicide. But the polls don't tell the full story, and as we know that. I mean, we know the way you ask a question in a poll will determine the answer that you get. And there was an interesting poll done in New Zealand. They're also having a debate about it. It was they found that whilst expressing for assisted dying, respondents were also confused about what the term assisted dying means. So the more strongly a person supports assisted dying, the more likely they are to be confused about what it includes. So of those who strongly support assisted dying, 85% thought it includes turning off life support, 79% thought it includes do not resuscitate or no CPR requests, and 67% thought it includes the stopping of medical tests, treatments and surgeries that are futile. So in all three cases, however, a person would die from the underlying medical condition of natural causes, and these three life choices are already legal, and people can make those wishes known through advanced care planning. Similarly, there was a poll in England that found when people were exposed to the arguments for and against euthanasia and delved into some of the complexity surrounding the debate, their support dropped quite significantly. And Hope conducted polling during the Victorian Victorian campaign, and it found that once people found out that doctors were against it, their support also dropped. And when they were asked, what should the government be spending money on, finding cures, funding palliative care or on assisted suicide, 80% of those thought that they should prioritise finding cures and palliative care. So the more we talk about the issue and what's actually involved in the debate around euthanasia and assisted suicide, the more we will change people's minds. And this brings us back to the discussion we had at the start about what it will take to win the cultural debate on this issue. Being involved, talking about the issue, entering the fight in the long term and putting our resources into the fight as well. So Hope, the Australian Christian Lobby and others will have a presence here in the campaign in WA over the next few months. Our goal will be to have a unified collaborative approach, and it will be about influencing the politics on this and politics changing culture. So I strongly urge every person in this room to become activated in this campaign in your state, because every voice matters and every voice can make a difference. Thank you.